Good morning, everyone. We have Lex Ecker today, my guest. So, Lex, can you introduce yourself or your background and why this topic is so interesting for you? The topic of fraud by our some officials related to the COVID mandates.
Well, my background is in financial analysis. I look at financial statements, and I have an affinity with markers of fraud in financial statements. So when the COVID pandemic occurred, it didn't take long for the public narrative to display signs of deceptions, and this is what brought me to into the arena of uh, dissidents um, with respect to the COVID response of governments. Yeah.
So, again, can you just tell us more about this investigation which you have done into Freedom of Information request?
So the background is in there's a doctor in British Columbia. His name is Dr. Off, and Dr. Off was a vocal critic of the COVID response of the province of British Columbia. And as a result, Dr. Off went on tour in the province and he tried to warn people that the COVID vaccines were harmful. And as in response to his public advocacy, the College of Physician and Surgeon of British Columbia decided to discipline him, and then Dr. Ruff had to obtain legal representation. His lawyer was Lee Turner, and in 2023, Lee Turner filed a Freedom of Information request with PHSA, which is Public Health Service Authority of British Columbia. And in his FOIA request, Lee Turner asked like for all the data uh, related to AEFI, which are like adverse effect following immunization. So these, whenever someone receives a vaccines and they have like an adverse effect following the vaccines, it doesn't mean that the adverse effect is related to the vaccine. It just means it occurs following the vaccine. Then doctors are obligated to file a report. They call it an AEFI report. So all these AEFI reports are received by the health authorities of British Columbia, and they are then funneled to the BC CDC, which is the British Columbia Center for Disease Control. And the BC CDC compiles statistics and monitors AEFIs of all vaccines. So they were responsible for monitoring the AEFIs of the COVID vaccines. So this is the meat of the FOIA request that Lee Turner obtained from the PHSA, which is the umbrella organization that runs the BC CDC program.
Okay, and I'm just
And
putting on the screen right now the two Substack articles which you published in this
yes,
regard.
so so let's move on
Uh,
with the story. Is PHSA eventually released the information to Lee Turner. They answered his FOIA request. They answered it around June 2024. That was a little bit more than a year ago. And in a Zoom call, Lee Turner was simply telling the public, "Hey, I've received this FOIA request. Is there anyone on the Zoom call who's interested in looking into it?" And of course, I raised my hand because I love data. I am one of my key strengths is to go through large volumes of data, and by large I mean like thousands of pages of data. I can do that. I've got various techniques and skills to go through large volumes of data. And so I started looking at the FOIA request, and I would say like within 3 hours, within an hour or so, I just perused it quickly, and I realized that it was the bulk of it was mainly AEFI reports of two kinds. Some of them were non-public AEFI reports, and the others were public AEFI reports. So I need to, so this was the main content of the FOI request. And of course, between these AEFI reports, within the FOI request, we had also like internal emails between public health officials discussing various aspects of the COVID vaccine. So the FOI request is composed of emails between public health officials discussing AEFIs. We have public-facing AEFI reports that the BC CDC started issuing in April 2021 and onward. And we have also non-public AEFI reports that were for only like internal consumptions. What is very important is that the public and the non-public AEFI reports issued by the BC CDC, they tell a very different story, right? So of course, like the public-facing AEFI reports simply convey to the public and also to physicians who are the consumers of those public reports that there's nothing wrong with the COVID vaccines. The level of harm is well below the or is comparable to the flu rate or even below the flu rate. Not below the flu rate, but comparable to, and that everybody should take the vaccines. So the public-facing AEFI report issued by the BC CDC, in my opinion, have deceived the entire medical community. So physicians were relying on those public-facing AEFI reports to tell their patients, well, no, the BC CDC is monitoring everything, and according to them, the shot is safe and effective. But that
So
wasn't the
if
case. No. Now, the non-public facing AEFI reports contains very different data. And they clearly show, you can clearly infer by looking at the non-public AEFI reports of the BC CDC that the COVID vaccines were in fact like harmful, very harmful, and that the level of harm was off the charts. So in a nutshell, this is what the FOI request coming from British Columbia, issued by PHSA, Public Health Service Authority. This is what it tells. That's the story. Now, I wrote 2 Substack, and the first Substack is mainly like presenting the FOI request, and it's about like what public official knew and what they didn't tell the public. The second Substack that I put out was focusing on Dr. Bonnie Henry. Dr. Bonnie Henry is the provincial public health officer of British Columbia. She is the equivalent of, I would say she would be the equivalent of Theresa Tam at the federal level. She would be the equivalent of Anthony Fauci in the United States. That's but for British Columbia. That was her role. And what I found is I found a press conference of Dr. Henry on March 15th, 2021. During that press conference, that's at the beginning of the vaccine rollout. That's very important. And during that press conference, Dr. Henry made several statements. And in my second Substack on AEFIs, I contrast the statements that she made with the information that she had, right? So the FOI request that PHSA released clearly shows that Bonnie Henry, Dr. Henry received a non-public AEFI report in the morning of her press conference, and the data that she had received in that very morning contradicted what she was conveying to the public in the afternoon. That's my opinion, right? I mean, they can, like public health official, they can argue that, well, in their opinion, the AEFI rates were still acceptable, but they could hold that position. But I think in the mind of a reasonable person, that they wouldn't agree. And it's my opinion that it's the AEFI rates that she had at hand were clearly showing that the COVID vaccines were unsafe.
Uh,
Not only,
if 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 I could recap the key point here, how you got involved into analysis of this freedom of information data. Dr. Hoff in British Columbia uh, was fired because he expressed concerns which he has witnessed himself
oh,
with his patients with in particular about particular lot. There was particular lot of batch number of the vaccine which
yes.
somehow seemed to be worse than other
All
batches.
right. So
And
I'm going to speak more to that. Dr. Uff, I don't think the right word is to say he was fired. He was simply disciplined. So my understanding is that as he was like doing public tours, and shortly after that, he lost his hospital privileges, I think. I'm not sure if that's accurate, but I think that was the case. And so he was disciplined by the college, and then he had to defend himself. So he hired a lawyer, Lee Turner, and I've already, mentioned that Lee Turner filed a FOIA request, and I got involved in the analysis of that FOIA request. Now, let's speak a little bit more about Dr. Off and the circumstances of Dr. Off. So, Dr. Off lives in a very small community in British Columbia called Lytton. In early 2021, it's a very small community. It could be like something like maybe 1,000 people. My understanding, it's mostly First Nation people who live there. And at the beginning of the rollout, and Dr. Off is a family physician. So several of his patients who received the COVID vaccine, they reported like severe adverse effects. And this is what we're showing here in this grid on one of my Substack. And he filed Dr. Off as a physician once, he's obligated to file adverse effect reports, an AFI reports, and he filed 11 of them. And 10 of these 11 reports are coming from the same vaccine lot, a Moderna lot. So that in and of itself tells you that there's a problem. This is a cluster of adverse effect concentrated in a geography and with a particular medical product. When you have a cluster of adverse effect, then this should trigger an investigation from the at the end of the public health with the public health authorities, because I've read a little bit of their protocols, and they monitor adverse effects of various products. And when you have a cluster, that is, it could be like geographically associated, it could be temporally associated, it could be like a particular lot. You have a cluster, a common point, then you have to investigate. So what's important about the cluster of AEFI that Dr. Off reported is that they occurred like early January 2021. It's the same batch of Moderna. Now, coincidentally, at the same time in the United States, in San Diego, another Moderna lot triggered a cluster of AEFI report, right? and that caused uh, the public health of, I think it was the public health of the county of San Diego. It caused them to suspend the distribution of vaccines for about a day or two. And during that day or two in early January 2021, they the public health of the county of San Diego, Moderna, and the FDA, they were all like talking internally, having discussions like how they were going to manage this, and eventually they decided to resume the distribution of the COVID vaccine. So what Dr. Ruff reported in early 2021 is not isolated. And one thing that I see from the emails and the FOIA requests is that the BCCDC and Dr. Henry and Dr. Monica Naus of the BCCDC, they are well aware um, of safety issues arising in other jurisdictions because they talk about those other issues like arising, let's say, like in the UK or in the United States. So all the health authorities in the world are all monitoring each other, right? So like we can presume that the BCCDC was very much aware that a similar cluster of another Moderna lot, had been found in San Diego. So for them, that was not a surprise. Um, and then if we fast forward a little bit in March, on March 15th, 2021, the internal AEFI report that Bonnie and Riyadh had like AEFI rates, like per lot numbers. And the Moderna lot that Dr. Off reported EFIs on, it was like the second most toxic one. I mean, if we think of toxicity in terms of like the highest EFI rate, well, it was the Dr. Off reported lot that was the second most toxic at the time. And then like later on in 2021 and in 2022, then the regulatory apparatus, like exercise lawfare against Dr. Off. And but they very well, so here what you're showing is go back a little bit up. So this is just a summary. This is an internal email that you're showing, and the date is March 15, 2021. So this is in the morning, right? And it shows the total number of AEFI, then the serious AEFIs, um, and then in the FOIA request, there's a more detailed grid that shows like AEFI rates per vaccine lot.
Yeah,
So
that's the actual document. So, and anyone can go there and can just start reading it. But
yes,
it's
so
quite
yeah,
big.
yes, so it's a little bit more than 1,300 pages, and I know that document very well by now. This document is available for download from the website of Lee Turner from his law firm Doak and Sheriff, and I've also like linked to it. So if you go to my Substack, you
Yeah,
you you
yeah,
will- you will you will find a link to the source document.
that's
So
right.
this is
That's right.
all
And
official
I will
data.
include it. I will include it also in my Substack as well. I'm preparing a Substack where I will include
Yeah,
your previous presentation at another forum,
yeah,
and I will also include this presentation here. So all the information is publicly available. The problem is that the document is big and
yeah.
no one will be reading it. So
Well, I mean,
yeah.
it's a lot of data, and I can understand that the public in general like doesn't have the time to go through this.
But I guess
So I did. So I
even
did.
the very fact that there was so much communication, as you've mentioned, uh, just the sheer amount of communication which was created through by some concerned doctors, I don't know, or agents, is already a red flag in some sense.
Well, yes, I mean the FOIA request shows like several emails discussing AAFIs. I don't think it shows everything, but this is enough for us for the public to come to the conclusion that that public health officials in British Columbia were aware that the COVID vaccines were harmful and that the level of harms far outweighed the documented benefits at the time. Right. So now what you're showing here, so the grid that you're showing, it's the data is coming from the FOIA request, and what I did is I simply like transcribed it. So all these numbers, they're all accurate, and they can all be traced back to the FOIA request.
So just to
Um,
make sure I understood correctly, these are exactly the numbers which are published in the FOI
yep,
response.
yeah, these are
And
not inferences, they're not calculations that I made. They're simply numbers directly transcribed from the FOI requests. So the grid that you're showing here, this is a sporting data. So this is the AEFI rates per vaccine lot as of March 15, 2021. And there's an email in the FOI request that clearly shows that Bonnie Henry was in possession of those AEFI rates. And then later on, the very same day, she went on and made several statements that don't reconcile with this data, right? So
uh,
what I've so and as of March 15, 2021, about 14 Pfizer and Moderna lot had been distributed so far. And this level of arms like goes on. So as the vaccine rollout proceeds all the way to the end of 2021, we have more like AEFI data in internal reports, and the level of arms is consistent. So this is not this is what you're seeing here, like it's not a peak. It's actually like it represents like the overall pattern of harms. Now, what is important, like one thing that the public can can think about, like when you look at this data, you see 14 vaccine lots, I think. There's 14 vaccine lots of Moderna and Pfizer. And a key observation is that the rate of AEFI is highly variable. It means it's not stable. So, in the mind of the public, when the public takes a medication, let's say like you take a Tylenol or
yeah, yeah.
you expect that the effects are going to be stable and predictable, right? Now, what the variability of AEFI rate shows is that it shows that the